Welcome to Keiser Voices, the story of success, brought to you by Keiser University Graduate School, here where the academic world meets personal triumph. Join us today as we dive into the captivating tales of success.
Hi, my name is Teresa Slade. I am the Student Services Director at Keiser University in Tallahassee, Florida. I'm also a Keiser alum, having received my bachelor's degree in business administration, as well as my master's degree in business administration. I also hold a PhD in theology. So this is Black History Month, and so we are going to be looking at some African Americans who have been instrumental in healthcare as far as diversity, equity, and accessibility to healthcare services for people of color. So the first thing that I kind of want to talk about is before you can actually get to the point of equity, there has to be diversity. And so in looking at the healthcare industry, we need to see more African Americans operating in this particular field. We need to see more African American physicians, practicing nurses, radiologists, just all aspects of healthcare. And so there are some dynamic African American physicians who have been pivotal in ensuring that this does occur. And so I just want to talk about a couple of those. And one of them is Dr. Lonnie Bristow. He is an African-American physician who has contributed to healthcare innovations. Those innovations are leading toward diversity, equity, and accessibility in healthcare. He served on the board of the American Medical Association, and later he became the first African American president of the American Medical Association. And during his time as president of the AMA, one of the key things that he did, he introduced the topic of ethics in medicine and ensured that there would be added courseworks to the curriculum, as well as questions on the medical board exams. He was also the first president of the American Society of International Medicine. And throughout his professional career, he served on various boards and committees, including the advisory committee for the Center for Disease Control and Prevention relating to smoking and HIV infections. And Dr. Bristow, an internal medicine physician during his practice, and he focused on sickle cell disease and HIV/AIDS. Now, when we talk about sickle cell disease, this is a disease that greatly impacts African Americans, and 1 in 12 African Americans will actually be carriers of the sickle cell gene. And this is something that kind of hits close to home for me, because sickle cell disease is one of the things that my family actually deals with. I have an uncle who has sickle cell disease. I've had other relatives to die from sickle cell disease. I do not have the sickle cell trait, but my mother and my brother also have the sickle cell trait. So it's very important that we understand this disease because it greatly impacts the African American community. So that's why it's important that we have physicians that understand the biology of African Americans, and why it's important that there is that diversity within the healthcare profession to focus on things of this particular nature that greatly impacts African Americans. Dr. Bristow is an author of many publications, including The Myth, one of his publications, The Myth of Sickle Cell Trait. He also authored the publication AIDS and the Response to Organized Medicine. He co-founded the Sullivan Commission with Dr. Lewis Sullivan, and this was to address diversity in the medical profession. He is also the co-author of In the Nation's Compelling Interests, Ensuring Diversity in the Healthcare Workforce. So he is a current innovator in the healthcare field that is pushing toward diversity, pushing toward equality and accessibility when it comes to healthcare for the African American community. One of the other influencers is Dr. Lewis Sullivan, who we mentioned, who has done some joint work with Dr. Bristow. Dr. Sullivan was engaged in participating on different committees. He served as the Secretary of Health and Human Services under President George H.W. Bush. And this is important because if there's going to be policy changes, it has to be promoted through committee involvement. It has to be promoted through being involved and having appointments in positions that are influential, to where you're able to introduce those subject matters that are important to the African American community. So for Dr. Sullivan and his appointment as the Secretary of Health and Human Services under President George Bush, that was something that was very beneficial for the work that he was able to do. The Sullivan Commission was a collaboration across different industries, not just healthcare. It was also people from the business community. There were also people involved on the commission who were experts in the legal field. There were also politicians who were a part of this commission. And it was through policy recommendations that changes were being made, and you were beginning to see more diversity in the healthcare field. Now, there's still work to be done, but we're seeing more and more minorities becoming part of the healthcare profession, and they're very necessary to be able to identify the differences between brown-skinned people and Caucasians, because there is a difference when we're looking at healthcare and we're looking at the treatments, and we're trying to understand why do we have more people of color dying from diseases that they should not be dying from, such as diabetes and high blood pressure and things of that nature. They're dying in greater numbers than what we're seeing our Caucasian counterparts. And so it's important that we have African American people and people of color in the healthcare profession so that they can continue to be innovators and bring things to the forefront and talk about the differences in treatment for people of color versus Caucasian. Because what we're finding is that when it comes to medical schools and when it comes to the training that is being delivered in medical school, often those studies are based upon Caucasians and not African Americans. One of the things that, when we look at blood pressure, we look at the standard reading for what is considered to be normal blood pressure. That is based upon Caucasians. But when it comes to African Americans, our numbers may be above normal range of a Caucasian, but it's considered normal for the African American. So being able to distinguish those differences is very important, and that can only come when there is diversity within the workforce of the healthcare profession. Another thing that I want to talk about as we're looking at African American innovators in the healthcare field, I want to talk about a couple of medical students and what they are currently contributing to the healthcare profession to ensure equity and accessibility of services. So one of the things that's very important when we look at medical students and the research that they're doing and how they can contribute to healthcare equity, it has to be through collaboration. It has to be through the educational institutions wanting to support the research and collaborating and assisting medical students to get this information out to the medical community. We see one example with one medical student, Malone Makunde. He's a medical student, and he identified that there is a problem when teaching about different types of skin disease, and the illustrations that he saw in his medical class relating to skin diseases was always related to Caucasian skin. He did not see where darker skin tones, illustrations of darker skin tones, and how these diseases would impact darker skin tones, because it can be the same disease, but that disease can manifest differently based on the skin tone of the actual patient. And this is something that I also encountered myself in dealing with my own issues with dermatology. I woke up one day and there was a spot that I had not seen. I went to the dermatologist. He examined me. He did a biopsy. He sent the biopsy off to be tested, and it came back and they had diagnosed me as having cancer. And so when he received that diagnosis, he sent back and asked them to do additional tests, and he identified me as an African American female so that they would know the patient. And once that was done, the diagnosis was different. It was not skin cancer. So it is very important that in the medical profession that we take into consideration the patient. What is the heritage of the patient? Is this an African American patient? Is this a Caucasian patient? Because the symptoms of the disease will manifest differently based on the skin color when we look at dermatology. And so this student recognized that. And so he recognized the problem and he developed a solution. And he was able to partner with 2 faculty members to publish a medical guide. And the guide is titled Mind the Gap. And this guide is for doctors to be able to use when they're diagnosing skin diseases on people of different colors. And this medical student was able to do this through collaboration, being able to come together with the Educational Institute, bringing it to their attention and being allowed to do that research and having those faculty to join with him to get this publication out, to get this information out to doctors so that when they're dealing with patients of different skin complexions, they're able to better diagnose the patient and to be able to diagnose the patient correctly. And this is how we come to the place to where there is equality in healthcare. There is equity in healthcare. And so this was a medical student who was able to do this. There's also another medical student, Angela Undogo, who is a Nigerian American medical student. And she is teaching radiologists how to interpret x-rays of patients who have Black hairstyles, such as braids, twists, and locks. You can see with my hairstyle that I'm wearing today that I have braids. And so when x-rays are done, the images of the hairstyles can come across in x-rays and appear as what they refer to as artifacts. And in x-rays, artifacts are basically the easiest way to describe it as abnormalities that would show up on x-rays and could be perceived as not being normal, resulting in patients being misdiagnosed, could be mistaken for disease when in fact it is not disease, resulting in patients receiving unnecessary treatments, resulting in patients receiving unnecessary additional x-rays and being exposed longer to radiation. But she has been instrumental in demonstrating that we yet again, if we're going to have equity in healthcare, we have to be mindful of who is the patient. What is the distinguishing differences between an African American patient and a Caucasian patient when you're doing x-rays? Don't assume that this is an abnormality or this is some type of artifact in the x-ray, but mention that this x-ray is on a person who has braids. This x-ray is of a person who has locks. This x-ray is of a person who has twists, so that the doctor could be mindful of that when they are reading the x-ray, So communicating that information and letting there be an awareness. So what Angela did in order to basically prove her theory was that she showed doctors x-rays of African American patients who had braids, who had twists, who had locks, and asked them, what are you seeing? When you look at these images, what in fact are you seeing? Are you seeing Black hairstyles, or is this something related to pathology to identify that there is an abnormality within the patient? And so statistically, when we look at radiologists, 70% are male, and of the 70%, only 3% are Black. And so this is very important. That gets back to the issue of diversity. But the thing that is so beneficial of the work that Angela is doing, it's the awareness and letting them know when you are doing x-rays of patients, we need to note what are those differences. We need to note that this is an African American. This is an African American that has they refer to as protective hairstyles, such as the twists, braids, or locks. And so her work, her continued work that she's doing now, even as a medical student, is bringing awareness. It's bringing equity and better quality of service to the healthcare profession when it concerns the African Americans. And so I truly hope that with this being Black History Month, I do hope that this podcast has introduced you to information about African Americans in the healthcare field, some of the things that the innovators, we see that everyone that I spoke about today, and this was very intentional on my behalf, I wanted to speak about people who are here today, making differences today. We have numerous people that we could have talked about that made changes many, many years ago, but these are people who are instrumental today, who are living among us and making the difference so that we see equity, diversity, equality, and accessibility for African Americans. So I sincerely hope that as we are celebrating Black History Month, that you are continuing to learn about the different contributions that African Americans are making, or have made, and are continuing to make in our society today, which is beneficial to all people, people of color, all people. So I want to thank you for watching this podcast, and you can continue to follow us on social media and view other podcasts.
Thank you for journeying with us today on Keiser Voices, the Story of Success. As we close this chapter, remember, every story has its next page.